Hi, my name is Nadia Edina binti Muhammad Rashidi and my metric number is 08TEU 23F1150, and today I'm going to introduce to you about my innovation, which is sinus monitoring, the Nasalystic. So for introduction, sinusitis is a common condition that causes nasal congestion, headache and breathing difficulty. Many people struggle to monitor their sinus health effectively because current methods rely on manual observation and clinical visit. To solve this problem, sinus monitoring the Nasalystic was developed. It was a smart system that used sensor and IoT technology to detect changes in sinus condition such as temperature, humidity, and pressure. The system provides real-time data that can help user and doctors monitor sinus health easily and efficiently. This project introduced sinus monitoring the Nasalystic, a smart system that monitors sinus condition in a real time. It uses sensor to measure temperature, humidity, and pressure around the nasal area, with data sent through an ESP32 microcontroller to the Blink app. Continuously monitoring helps users detect yearly signs of sinus problem and take preventive action. The project aims to improve health awareness and provide an easy, portable, and effective way to manage sinus condition. So, the objective for this project is 1. To monitor sinus conditions such as temperature, pressure, and humidity in real time, to provide instant data and feedback to user or healthcare provider, and lastly, to detect sinus problem yearly and improve treatment effectiveness.
Sinusitis is inflammation of the paranasal sinuses, which are pairs of air spaces that surround the nose in front of the face. Usually, acute sinusitis can last up to 4 weeks, subacute sinusitis lasts between 1 and 3 months, and chronic sinusitis lasts more than 3 months. When you breathe in, air flows through the nostrils and enters the nasal cavity, which is lined by goblet cells that release mucus. That mucus is salty, sticky, and has lysozymes, which are enzymes that help kill bacteria. Nose hairs at the entrance of the nasal cavity get coated with that mucus and are able to trap large particles of dust and pollen as well as bacteria, forming tiny clumps of boogers. The nasal cavity is connected to 4 paired paranasal sinuses, named according to the bones in which they lie. The largest are the maxillary sinuses, found right below the eyes. Then we have the ethmoidal and the sphenoidal sinuses, behind the eyes. Finally, the frontal sinuses are in the forehead, right above the eyes. The paranasal sinuses act like tiny echo chambers that help amplify the sound of your voice, which is why you might sound different when they're clogged with mucus during a cold. They also allow the inspired air to circulate for a bit so it has time to get warm and moist. Like the rest of the respiratory tract, the walls of the paranasal sinuses are made up of a mucosal epithelium. The mucosal epithelium has goblet cells, which produce mucus to trap small foreign particles, as well as columnar cells, which have cilia, which are tiny little hair-like projections that move mucus, draining into the nasal passages. One of these passages is also called a nasal meatus, and there are 3, the superior meatus, middle meatus, and inferior meatus, all of which help drain mucus. The sphenoidal sinus drains to the sphenoethmoidal recess, which is a small space in the nasal cavity right above the superior meatus. The ethmoid sinus can be divided into posterior, which drains to the superior meatus, middle and anterior, both draining into the middle meatus. And finally, the maxillary and frontal sinuses drain into the middle meatus as well. Most cases of sinusitis are acute, and are the result of a viral infection. The most common viruses include rhinovirus and parainfluenza virus, which cause the common cold, and influenza virus, which causes the flu. Bacterial infections are another cause of acute sinusitis, and the most common bacterial strains are Streptococcus pneumoniae, Haemophilus influenzae, and Roxella catarrhalis. Sometimes bacterial sinusitis develops during or after a viral infection, but other times it might develop due to a blockage of the normal flow out of the sinuses, like with a deviated septum. In acute sinusitis, an invading pathogen often causes an inflammatory response to the invading pathogen. This causes the goblet cells to over-secrete mucus, which also leads to congestion. At the same time, immune cells try to fight off these pathogens, and this can create pus, which is a mixture of pathogens, immune cells, and dead tissue. If acute sinusitis doesn't resolve quickly, then it's considered subacute or chronic sinusitis. In addition to infections, another cause of subacute or chronic sinusitis are environmental allergies, like the dust, pollution, or even fungi, like aspergillus in some immunocompromised people. Finally, in response to allergies, some individuals develop chronic hyperplastic sinusitis, which is where the connective tissue of the sinuses undergo hyperplasia, meaning it starts proliferating faster than usual. This can give rise to nasal polyps, which are non-cancerous outgrowths of inflamed tissue in the nose or sinuses.
First, the user wears the mask comfortably. And connects the device to the Blink app. Once connected, the system begins detecting humidity, pressure, and temperature around the nasal area. If any of these readings exceed the safe threshold, the buzzer on the device will activate, and a notification will appear on the Blink app.
So in conclusion, the Nasalystic offers a smart and efficient way to monitor sinus health. By combining sensor and IoT technology, it's allows real-time tracking and early detection of sinus problem. This project not only helps users manage their health better, but also support the development of modern portable medical monitoring system.